On today's podcast,
and this is like happening across the board, men who are 50s or 60s, 70s. So sometimes it's really fun to ask the men like, oh, how are you doing? Even if they're 40s or 30s, they don't often have morning wood. And then guess what? It resurrects just like their gut flora on a Zoomer test or other stool tests. We'll see all the flora go up. Well, that will go along with their biology and physiology as well.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Welcome, everyone. I am one of your hosts today, Jen Rivas, and it wouldn't be the Vibrant Wellness Podcast without my amazing co-host, Dr. Emmy Brown. Say hello to our listeners, Dr. Emmy.
Hello, listeners. Thanks for being here.
Awesome. Well, today we have a very special guest joining us, Dr. Grace Liu. Dr. Grace is a renowned functional medicine practitioner who has made significant contributions to the field of gut health and microbiota. Her extensive background and achievements have established her as a leading authority in the world of integrative medicine. One of Dr. Grace's notable achievements is her popular book titled 7 Steps to Heal SIBO, Simple Strategies and Exercises to Understand SIBO, Restore Energy, Beat Belly Fat, and Eliminate Brain Fog. With her vast knowledge and expertise, Dr. Grace has built an international integrative medicine practice that offers various services. She conducts group classes, private consultations, functional laboratory analysis, and personalized gut protocols. Dr. Grace recognizes the critical role that the gut plays in overall health and well-being. We are truly fortunate to have her here with us today. So without further ado, welcome, Dr. Grace. Thanks for being here today.
Thank you so much for having me.
Yeah. Hi, Dr. Grace. I'm going to kick it off. Thank you so much for being here. I'm so excited because today we're going to dive into one of our favorite topics. Of course, the microbiome is a subject we talk about a lot, but from a little bit of a different angle. We're going to dive into the microbiome's wide-spanning influence on metabolic health, the role of Akkermansia in promoting leanness and insulin sensitivity, the root causes of fat gain, and the practical advice for wellness practitioners to integrate these insights into their practice. So before we jump into Akkermansia, which I'm really interested in, will you tell us how you became interested in the link between the gut microbiome and metabolic health, please?
I actually, hard to believe, but I was overweight a lot of my life. Through my teens, my 20s, especially after I had my 2 daughters. I was like a typical celebrity mom kind. I just ate everything in sight and gained 70 pounds. And then it was quite a challenge, postpartum, losing the weight. And I found out that birth control affected my weight gain because as soon as I got off it, I easily did lose weight. And so the only time I was off it was either getting pregnant or postpartum lactating. And I found it was so easy to lose weight. And I really did see the role that pharmaceuticals have on women's weight gain. Women are right, or the men who drink xenoestrogens in their municipal water. Poor guys, right? Downing all the birth control through municipal water. So when I lost 50 pounds of weight, the last 5-10 pounds, you tend to regain and re-lose over and over and over in different cycles. And particularly during pandemic, I regained 10-20. I got the COVID-19 pounds and then I had to lose that. So now I've really dug down different rabbit holes and perimenopause even, looking at ways we struggle with weight loss and weight gain and all the different reasons for weight gain. There's epigenetic. Now we have C19 and long COVID, long haul. And then the massive amounts of toxins in our food, air, water, wine, everything has toxins in it.
Okay. And so we tend to think about the microbiome and GI symptomatology. So I'm thinking we have practitioners listening and they say maybe stool testing is not indicated because their patients are free of GI symptoms. But I imagine you have something else to say about that. And you just touched on it. You talked about hormones, and that's just one piece of the puzzle, and toxic load. So I'm wondering, for example, what are the most common non-GI related conditions, signs, symptoms that you see that would warrant a stool analysis?
Just as Hippocrates talked about hundreds and hundreds of years ago, all disease begins in the gut. Little did he know, about the microbiome, right? And all wellness and longevity begins in the gut. If we look at a lot of the targeted, things that we do for longevity, it all starts in the gut as well. The gut is our largest source of hormones. It's our largest source of peptides. And as you know, I'm really into regenerative medicine and peptide protocols now. And, you can't beat a really healthy gut microbiome that pumps out these protective peptides that are regenerative. So we, look good and lose weight easily, have satiety, like the GLP-1 agonist peptides, tirzepatide and dual agonists and semaglutide and others. So it really is the gut. And so let's say 3 signs that people might have, even though they don't have outright overt gut problems, like bloating or gas, burping, diarrhea, constipation, but they can have brain fog, fatigue, or fat gain. And we help people at our Gut Institute to reduce these in 6 months or less. Yeah, it's not hard at all because I focus on the gut, but the gut's not everything. Because once things go awry, we have this whole, it's like a domino effect, the adrenals and HPAT axis, that stands for hypothalamus, pituitary, adrenal, thyroid, and thymus axis, they just shut down. We go into 2 different channels of life. One is high fertility, great hormones, great adrenals, great gut, right? And then we go into another channel. I call it fucked. So we have fertility or fucked. You might have to bleep that out. And we can't actually have both, as you guys know. You probably help people, right, with infertility, men with low T or women low P.
It's a huge issue right now.
It's huge. And it's sad because this is the first time in human history, children, teens are dying before their parents with age-related conditions. And if they have really healthy grandparents, they're even passing away and getting old age diseases before their grandparents. It's the first time in human history this is recorded. So we're seeing fatty liver, obesity, type 1 diabetes, heart attacks, heart failure in just teens, and a lot of cancers as well. It's all related to the gut. So it's brain fog, body fat, fatigue, but then all these chronic age-related diseases.
Yeah. I always like to peel back the onion a little bit more. Now, I know you mentioned, it was your own personal weight gain that kind of got you interested in this, but were you already on a trajectory for, opening your practice, or did that kind of come after the fact?
So one of our mottos is bugs over drugs. I am a pharmacist, and I learned firsthand how terrible many pharmaceuticals are to our human anatomy and physiology. And for me, it was many interventions like an intrauterine device, which is a device with a surface on it, which acts as a biofilm to microbes, as you know, candida, viruses, fungi, and bacteria. I also had a dental implant, so I had dental interventions. And then what went along with that was antibiotics that I didn't need, anesthesia, as well as, after I got brain fog, I wasn't really careful. I got a tetanus shot that I didn't really need. And then that was just like a trajectory, vaccine injury, which took my health down. I had chronic fatigue for about 8 to 10 years, and it took me quite a while to get out. So I left pharmacy to become a functional medicine practitioner just so I could actually help myself. And then it turned out a lot of the protocols that I developed along the way actually help a lot of people. Many people have ancestral type of DNA and genetics like I do. I am more like I'm an A blood type, and it's like blood type O as well, very ancient. And so modern interventions don't do really well with my genetics, and even gluten and dairy and things like that. But there was a period of time when I was really healthy and I was exercising a lot, and I actually could eat kind of all the gluten and dairy I wanted. I was very lean and a size 0 practically, and when we have good lifestyles and low stress, there's a lot more we can withstand despite what our genetics are. I'm also iron overload. That tends to be more ancient as well. As you guys know, iron contributes to a lot of microbiome dysbiosis. Iron is a growth factor for both good bacteria, but then also the pathogens and yeast and fungi.
So it sounds like definitely inspired by your own pathway there. And I've also heard you talk about the blue zones, which I am extremely interested in.
Yeah.
And the centenarians. And like, what are they doing that we're not? That's what I'm wondering. kind of what are good signs of health. And it should be obvious, but I also think that there are a lot of maybe things people in the States experience and we consider normal that are not so normal if you were to ask one of these centenarians in the blue zone.
Right, exactly. It'd be I've visited one of them, the one in Costa Rica. I'd love to visit some of the others like Okinawa and Bama, Italy. I mean, Bama, China, and Italians. Yeah. They're fascinating to review, and their microbiome tells us a lot. They have a 17-fold enrichment of a bacteria. It's a butyrate maker. It's called Eubacteria lamosum. It turns out it helps to up-level some of our flavonoids that we eat, particularly citrus flavonoids. And they likely get it from vertical transfer, from their moms, and then get enriched from their environment, right? Maybe fermented lemons in their alcohol drinks, or just on their tangerines and kumquats or whatever, They also have an enrichment of Bifidobacteria longum. Longum, they named it because it's found in high longevity individuals when it was discovered. And so our probiotic, Bifidomaximus, and we have another one called Microbiome Mojo, we have the highest strength in the market. We also extra enrich it at the time of manufacture, so it doesn't go down too much after travel and storage. And I'm really proud of our product because it has a consortium. All the allies that go with Bifidobacteria longum are present so that people can increase Akkermansia, they can increase really strong, vital keystone flora like the Clostridiolas and Eubacteria, like the one I mentioned, the lamosum, because we are missing these. We have bankruptcies after antibiotics, stress, low-fiber diets, even paleo diet and AIP diet. They're healing, but they're also extremely low prebiotic, low-fiber diets. And what little people have through our interventions as functional medicine practitioners, they're going to lose the rest. Because many of these are FODMAP intolerant. These bacteria, they feed on FODMAPs.
Yeah.
Particularly legumes, grains, soaked fermented whole grains. I'm a big fan of Weston A. Price. I was a chapter leader in my local area for a while. There's something to the ancestral diet that the centenarians that we love, they eat very rural farmer type of diets. They're not processed because it's called being poor. They don't afford, right? Like grocery store type of processed foods. They eat straight off the earth. And then they're getting the best probiotics. It's called dirt. It's like coating, their roots and leaves and, produce and plants. And then they have, if you look at centenarians, what's fascinating is that they get very little health care, which is terrible if you look at infant mortality risk, right? Fetal risk, mom dying during pregnancy and during births. On the flip side, they're not getting C-sections. They're not getting Pitocin. Any kind of intervention like an IV Pitocin for mom is also going to have IV antibiotics. Yeah, so we're not really, tweezering out, every factor to why we're so ill at this point. And why kids, are changing, and even gender, when we have a dysbiosis, we have more inflammation, it turns on aromatase. So for boys, that means more estrogens. For women, baby girls, it means aromatization means they get estrogen dominant. That extra estrogen becomes testosterone, as we see in our PCOS and uterine fibroid clients. But we can shut this down, by lowering inflammation. What I'll see is for low T men, low testosterone men, we can triple it in 2 to 4 weeks or less. For women, we really have to look at progesterone, right? It'll start to triple every month, double or triple every every 1 to 2 months when we bring down inflammation. There was a researcher, his name is Tremulin. He's done amazing studies on the microbiome, looking at LPS, polysaccharide from gram negative. He took a really healthy group of men. They had, I think their BMI was really low, like 19 or 20. They were super healthy. They were age 18 to 45. And he gave them just a low dose of gram negative LPS, which I think the gut zoomer checks, right?
Yeah.
And and zonulin, which is beautiful because he induced actually a hyperpermeability state. And within 6 hours, it was just a low dose, 0.8 nanograms per kilo of LPS. And within 6 hours, their testosterone tanked, like But these were healthy men. Their testosterone went back up again. So a lot of the clients will see when we heal the gut, we go through 4 phases with our clients or in our group class. We look at all the different potential pathogens and we resurrect what's not there, the bankruptcies that we may identify on a gut zoomer or a GI map or an organic acid test. And then we bring the flora back. And then what happens is there's a subsequent tightening of the gut lining. And that's what we want for life. And this is what all longevity studies show. And when we do that, naturally, we'll see without any kind of exogenous hormone replacement, we'll see hormones increase quite a lot. For women, progesterone can double or triple in a short period of time, usually 2 months or less, and fibroids and cysts all disappear. PCOS disappears.
Amazing.
And for men, their SHBG will cut in half if it's high. Sex hormone binding globulin is a terrible, terrible break for men. Their testosterone may look fine, but literally it's getting blocked by themselves because of stress, right? Gut inflammation and other inflammation. And then we'll see a concomitant increase either in free T or total T for most men. Yeah, and this is like happening across the board. Men who are 50s or 60s, 70s. So sometimes it's really fun to ask the men like, oh, how are you doing? Even if they're 40s or 30s, they don't often have morning wood. And then guess what? It resurrects just like their gut flora on a Zoomer test or other stool tests. We'll see all the flora go up. Well, that will go along with their biology and physiology as well, which is really
another
good
clinical measurement.
Yeah, it is. Because again, we have 2 channels in life. Your body knows it. If there's silent gut stress, right, brain fog, body fat fatigue, or other factors, it's really like we don't have fertility, right? We're fucked or we're fertile. There's like no question in between. Yeah, we see people, their LH goes up. I have a couple clients I take care of, sometimes couples. There's a time period like all of them got pregnant, despite me warning them, like, hey, you need birth control, you need backup method, blah blah blah. And they're like, oh yeah, don't worry. Oh my God, they all got pregnant.
You warned them.
Yeah, we restored LH surges and we restored, minimal progesterone, and it was like, oh my gosh. Yeah, but it's good. It's amazing to see the totality of life.
Absolutely.
We have all this like distress and disease going on, but then, thankfully for integrative medicine, like what you guys do and what you offer through the kits and all the protocols out there, we can see these, the health restore for people.
Yeah. And you mentioned addressing the gut, and you said it's not all about the gut. And I appreciate that you said that, Dr. Grace, because again, there's so many different factors. But you're talking about treating the gut and its impact on the endocrine system. So I'm wondering, generally speaking, if we're talking about a priority, and of course we want to individualize our medicine as holistic and functional medicine practitioners, but generally, are you treating the gut first, or will you ever prioritize maybe toxic mold illness, or maybe heavy metals if that's indicated for a patient?
Those are all really important, and I think we have data that shows everyone is affected, especially the younger someone is, right? The newer generations. And yes, those are all important. I like to go through 4 phases with all our clients. So the first phase, we kind of bring the adrenals back into line. But again, adrenals relies on gut health. If there's a lot of permeability, they're just stressed out because of the permeability. But then the permeability can't heal unless we address the cortisol and adrenaline dysregulation. So we do kind of both concurrently, but we start the adrenals, and then lymph and liver are very important. They come in during the first phase as well. So getting on liver support, calcium glucarate, if needed. Once we get the liver support on board, often people will naturally start to chelate and start some of the mold, remediation in their own body, I feel like. And then I make a probiotic, the Bifimaximus powder. The cell wall of Bifimaximus species in there, Bifido and Lactobacilli, the ones I use, they act actually as an ionic resin, just like Welchol and cholestyramine that we use in our mycotoxin protocols. And it's really important that clients are able to eventually tolerate this at a high dose. We do a gut reset protocol, which is literally 1 trillion CFU bacteria per day, which is a tablespoon of powder a day. And this literally, when people make this dose, that's the turning point. That's when their health starts to improve. They sleep through the night. Their mood gets better. Literally, they start to detox faster. Their heart rate comes down. Their oxytocin goes up. We see their heart rate variability. I like heart rate variability. It's the best longevity marker outside of, Horvath clock or telomeres. Telomeres is kind of useless. We want to really look at the physiology of someone day to day, night by night. So those are the keys that I do for lymph and liver and detox. But then we do go into mold and looking at the immune system relating to mold. It doesn't really matter how much mold someone has in their system. It's how their immune system is making IgG, IgM, and other immunoglobulins to it. You can have a little bit of mold, but if the body's just hyper alert, right, trying to glom on and eradicate the little amount of mold available, that immune system is what's holding back health because it's on hyper alert and it's just attacking everything in sight. If it's attacking even a small amount of mold, it's attacking a small amount of candida, a small amount of Akkermansia, and even potentially a small amount of bifido and lacto, which is our own really good bacteria.
That's a great point.
And we see that a lot. Yeah, in colitis, they're allergic to all probiotics because they're allergic to their own bacteria. Yeah,
So it's
we
that
have to switch
terrain.
that on. It's the terrain and our immune system, which is 80-90% the gut, as well as the flora, small intestines where the Paneth cells are, the G cells, the L cells. Our whole immune system is the gut mucosa, the small intestines. But it's not hard to switch now. So we do the gut protocols, the 4 phases. And lately, the last couple of years, installing in the right peptides. So before I focused on antimicrobial peptides made by the gut flora, feeding them bacteria feeding the bacteria with prebiotics when it's the right time to bring it on, like polyphenols are superfood for our healthy keystone flora. And when they're ready, we serve them something called bionic fiber, which is 20 to 40 grams of prebiotics, soluble, insoluble fiber, and a lot of oligosaccharides, XOS, GOS, FOS, all of it. Now, and by doing that, we feed them and then they make the right antimicrobial peptides. Some are circular, some are long chain, some are short chain. These are all targeted to different pathogens. Some are anti-Lyme, anti-Borrelia, anti-Spirochete. Some are anti-Epstein-Barr, some are anti-Candida. And this is why healthy people don't get sick and they don't get Lyme despite tick infections or mold exposures. Does that make sense? Mm-hmm. Yeah. A lot of clinicians, I think, out there think, oh, we're going to eradicate this. They think everything's going to be fine, but they're still ignoring the bankruptcies of the gut.
Huge deficit.
What mama didn't pass down, right? Or what antibiotics just, people love to give rifaximin. How many doctors do I see all the time just want to write that, 2, 3, 4, 5 rounds. Then next thing you know, client comes to me like they've got C. diff and they didn't have that originally.
Oh, I would do face palm.
I know. Yeah, it's terrible. They can die from it, from one of our interventions. Yeah. So what I love about the peptides, we use a lot of thymosin alpha-1, TA1. And that's been just totally game-changing. We don't do a lot of BPC 157 peptide. It's actually because it mobilizes mast cells and histamines. It's too bad the Gut Zoomer doesn't have the histamine panel. Like nobody does, but it'd be so awesome if you guys had it. Because our flora is all net histamine 0. It's histamine-free species, so it's really important for the mold and SIRS people, mast cell people. But BPC 157 triggers mast cells on purpose because it's bringing in immune cells. And so even though people may not realize it, they may get worse, even though they initially may get a little bit better with BPC 157. So we hold off on that. And same with TB4, thymosin beta 4, until a little bit later when they've done some gut remediation and done the gut protocol, like I mentioned, like doing Bifido maximus at the reset dose, 1 trillion bacteria daily, which is a powder, a tablespoon of powder a day.
It's very encouraging just to hear you and these cases that you're dealing with, and just knowing that, when you have the right tools in your toolkit, you can live a dramatically different life. So thank you for sharing that. I do want to take just a slight left turn for all the women that have dealt with the stubborn weight gain. I'm sure you hear it often, right? And I know among my friends and peers, they'll say, I'm eating healthy, I'm working out, I just can't move the needle on the scale. How do you approach those patients? And is there any tangible thing you could tell them, like right now, to prioritize to
Absolutely.
Really, yeah.
Yeah. All of it is a lot the gut. I love looking at our biology. We get satiety when we feed our flora. And the reason is because particularly many species, but including Akkermansia muciphylla, which you guys are so great at identifying and quantifying for us. And when we don't, it's a sweet zone. It's like a lot of our hormones. Too much is not good. It's like Goldilocks. Too little is not good. Yeah. We can see high amounts of Akkermansia actually with colorectal cancer, polyps, adenocarcinomas of the gut, and exacerbations of colitis. So too much is not good, but there's a sweet zone. 1 to 5% of the gut should be Akkermansia. And I love Akkermansia because it makes GLP-1, our satiety hormone. And so when I used to be overweight, or even just last year, okay, after C19 and Delta, I was just like ravenous, even though I was like eating all my macros, I was still hungry. I didn't have a satiety signal. It got broken somewhere. And after COVID-19, we know now, just like other, infections like mold or mercury, like our clients often will see, they don't have satiety signals because there's overgrowths as a result of those, situations. And there's Epstein-Barr living in all our glands. There's CMV found in our hypothalamus after COVID-19 or after mold or after mercury. And so when things are broken like that, and with obesity and metabolic syndrome, studies show that we have a huge candida overgrowth among other fungal overgrowths. This is underappreciated. So I like to look at organic acids and looking at the mold markers on there. But we want to assess it because in microbiome studies, that's true. Anyone dealing with overweight issues, they also have a candida overgrowth. And so when I go through 4 phases of protocols, it's really important to hone in on this for those really affected. If they've tried everything, they have resistant stubborn fat loss, resistant fat. And they probably have high degrees of candida, despite what testing might say. If it looks and smells like candida, guess what? It is candida. Yeah. Our testing's not quite there yet. Yeah, sadly, but if it looks and smells like candida, okay, guess what? It is candida. And so we'll do some antifungal botanicals, and then looking at other testing, and looking at their history, if it's men, they have a lot of tinea or like itchiness or dandruff, okay, yeah, they have outstanding candida. For women, if it's they've had many antibiotics, or they had C-section or surgeries, or implants that involve surgeries, they probably had IV antibiotics, so then they definitely have candida, whether the testing says it or not. So we'll actually use some pharmaceuticals in a very pulsatile intermittent manner. Okay, it's basically a toenail fungus type of pulsatile intermittent treatment. Yeah, but we always do botanicals. There's a lot of studies, 18S and Microbiome, MYCO-biome studies. If you overuse itraconazole, fluconazole, with daily use, you're going to select out the worst strains of Aspergillus, the worst strains of Candida. So the same problem we see with SIBO, right? We see the worst strains due to antibiotics that are difficult to get rid of, right? C. diff and the worst strep for people. Okay, that contribute to skin and the most terrible cystic acne and skin problems. So that's the treatment, okay? And then we install the good flora that take care of everything else. The gut reset becomes key, doing 1 trillion bacteria daily. And we're very careful of the probiotics. I love this signature probiotic I created because it doesn't have strep in it. Strep is not native to a human healthy biome at a high level. And the probiotic strep, it's called Thermophilus. It's not really a probiotic. It's not really helping our clients. If you check a Cunningham panel or you look at anti-strep IgG on LabCorp requests, often it's high. But even if it's medium high, it's still high because they shouldn't be attacking their own strep. Just like they shouldn't attack their own candida. I like to look at anti-candida antibodies too. It's a good proxy for everything else going on in the body, actually. And we want it at a better level. And that's where thymosin alpha-1 comes in, because we can reset the immune system while we're doing this. It happens so much faster now. So we really can help people lose weight, like in just 3 to 6 months or less, reach a lot of gain, reach a lot of their goal weight by then. So the gut is really important. And to build Akkermansia, because it releases GLP-1, chemicals, just like we would do tirzepatide or semaglutide. That's also known as Wegovy and Ozempic. We don't have to if we don't want to. And when we get fiber in there, we're building natural satiety, especially glucomannan. Glucomannan swells up. You have to be careful. I tell them, like, make sure you drink 2 glasses of water and don't use more than half a teaspoon a day because it swells up like a cement break within a short time, like 20 minutes. If you just step away, you go to the bathroom and then you go back to your fiber shake. It's like, whoa, it's like one cement block. You can't drink it. But that's what it does to our belly. And we're meant to have satiety. You know, ancestrally, we would forage for a paleo man ate 130 grams of fiber, it's estimated daily. But basically, he spent all day, 40, 60 hours a day, foraging for these high fiber foods. They didn't really do much else. They weren't inventing the wheel. They weren't inventing, you know, apps or in functional medicine protocols for sure. Yeah. So they're just spending all day, you know, eating. So I don't have time to do that. So I do like to just do a fiber shake. I'm kind of lazy like that. But those protocols are the ones we do. So Akkermansia will rebuild when we feed it polyphenols. It loves polyphenols. Studies show over and over its favorite food is FOS, which is a FODMAP. It's fructooligosaccharides coming from inulin. And inulin is in over 30,000 plants that are low sugar. They have a low glycemic index. So that means they provide a lot of satiety without a bump in their blood sugar. Like anyone doing continuous glucose monitoring, that's awesome. But if they're seeing like simple carb foods raising a spike, that's because they're not getting enough fiber to blunt it. Yeah, it's not just protein and fats that blunt the blood sugar. It's the fiber that we're meant to get ancestrally. Yeah, as paleo, as you know, our guts were originally paleo. But Akkermansia may not grow. You know, I see a lot of testing and gut zoomer kits. It doesn't grow, or people even use pendulum products. They have a PGC, pendulum glucose control, which is a consortium. You know, a whole bunch of really good probiotics, B infatis in it. Ours is way higher, like 10, 20-fold more. And they have Akkermansia in there. But we don't see people growing their Akkermansia. And the reason is because you need Bifidobacterium lactis. Not longum. You do need longum, but it's not as important. Studies show you need the lactis. And lactis is the most expensive part of our formula. It costs more than Coke per kilo. But that's the key. It's this bestie friend. And so you can imagine when they're separated, they don't, you know, flourish as well. And everyone's missing lactis, as you know from your testing.
Yeah, it's
lactis
very
is more
strategic
expensive.
how you do this.
Yeah, I test, don't guess. But also because everyone looks the same. It's because it's a trend, you know, that has happened for a while. Yeah. And Akkermansia, the pendulum probiotics aren't cheap either. They had cold chain issues. Like they had to really ship it on cold, dry ice. Now it's available on full script for a lot of us practitioners, so we can order it there, but they keep going out of stock as well. There's a lot of reasons why it doesn't, you know, flourish in the gut. There's 2 reasons. Number 1, B lactis isn't there. Number 2, people aren't feeding it well. It's like affection, right? You know, if someone doesn't feel affection, if they don't feel seen and heard and hugged and, you know, kissed, they're not gonna thrive. So that's the same with Akkermansia. It has to be fed, and it loves polyphenols. Like, so on full script, I love a product. It's called, and it's on Amazon and everywhere, but Poly Prebiotic. Yeah, it's all the plant polyphenols. Yeah, tastes so good too. And then it needs inulin with FOS. FOS, yeah. And I do like the HMOs. There's a couple good brands out there now. This is from breast milk, human milk oligosaccharides. But all the oligosaccharides do feed into Akkermansia and B lactis as well. But these 2 are really kind of key because baby was born with Bifido. You know, Bifido follows mom through the breast milk and vaginal secretions, but all through birth and then all the way until death. Especially if we have a long-lived lifespan. And Akkermansia does as well, too.
Well, I think this kind of is a perfect segue into the next question, which is, tell us more about the anabolic stacks for weight loss and the ways to resurrect Akkermansia for leanness, and insulin sensitivity.
I used to be a CDE, a certified diabetes educator. I'd start people on insulin, help them carb count, and the most profound things I saw when people got off their meds. What we did was we had, it was kind of an anabolic stack because it's part of diet and lifestyles that we do. But I look at people's food allergies and we cut out all of them temporarily for a month or two. So often that's the top 5 allergenic foods. So it's not exactly a stack, but it's a stack of lifestyle changes that people don't always consider. It's not forever. Often our clients, even if they're celiac, they're able to eat some gluten later without dying or like
Wow.
being in bed or chronic fatigue. Yeah. Some of our celiacs, they love to go to Europe. They're drinking beer and eating the bread over there and they're totally fine. And they're doing a lot of probiotics. They're doing our probiotic, 7 or 10 almost most days a week, and some Equilibrium. It's a probiotic. It's not a full script, but it gives us the U bacteria for butyrate makers. But if you do Pendulum, they have Clostridium butyricum. Also, probiotic 3 is Clostridium butyricum contained in there. We want a diversity in our probiotics. So that's when it stacks. Believe it or not, our probiotics can make us anabolic. And there's many mechanisms. They increase our GLP-1. They give us satiety, especially if we give them fiber as well. So that's the main gut biome stack. Okay, looking at diversity, doing what we can to build Akkermansia. Now, for other anabolic stacks, okay, this is going to get into the peptides. I love the human growth hormone stacks. So whether it's the fragment AOD, which stands for anti-obesity drug. It doesn't work for everybody. It's sort of 50-50. And then I love the human growth hormone releasing hormones or secretogs like ipamorelin and tesamorelin. Tesamorelin is sort of like the drug darling, pharmaceutical darling. It really is the Tesla of human growth hormone secretogs. So it's a little more expensive for people, but it does work really, really well, especially at, a full dose, 1 milligram a day. We do cycles of them. I do 3 to 5 days on and then a couple days off. Give the body like a cycling break to mimic our bioidentical hormone patterns and cycles. Now, the problem is a lot of people who deal with metabolic syndrome or they're pre-diabetic or diabetic, they're not going to tolerate these because their IGF-1 is high. They're already in a high proliferative state. That means they're precancer. And there's a risk of cancer with these human growth hormone secretogs. So you want to assess that risk as a practitioner, make sure your client understands them, and do all the screening and contraindications. Be aware of the contraindications. So if their IGF-1 is kind of high, if it's over 180, I think that's a little high. Help them to get it down first. Also, they're not going to tolerate these peptides very well. I didn't tolerate them very well either when I started. I would get all the heart failure symptoms and pitting edema. And my IGF-1 wasn't even that high, but I had some pre-existing stuff going on. But that's a lot of our clients, and it'll make them worse. So I don't use these actually first off. Another anabolic stack to consider is don't ignore basic lifestyle and diet and stress. I think that gets ignored when, so an anabolic stack is a GLP-1 agonist. So we have many now on the market. The ones I love are the dual agonists, tirzepatide and semaglutide, which is also known as Wegovy and Ozempic. Many insurances cover it now, and they have other accessible sources as well that are really fantastic, like compounding pharmacies. And I just love these because sometimes for those who have never lost weight, they had such a struggle with satiety because they were either overweight their whole life or just become uncontrolled because of mold or candida overgrowths or COVID-19 or mercury or arsenic or lead poisoning. They've never lost weight. They're highly estrogen dominant. Because all these situations cause estrogen dominance and or aromatization of our hormones. They struggle with weight gain and nothing works. These are the type of people, they look at water and they gain 20 pounds. I've been there. It's very frustrating. So these agonists, GLP-1 agonist pharmaceuticals are super helpful. I try to microdose, or do a stack where we're doing drug holidays and they remember what hunger feels like. And that they're not just like in a medically induced anorexic state, which can happen. And then we're getting into the same hole that anorexia is, especially the longer they're on these pharmaceuticals. If they're on it for over 6 months, 12 months, 18 months, we're seeing really deep health and metabolic problems as a result, and bone loss, as well as sarcopenia, which, as you know, truncate our lifespan. We never want to induce muscle loss. So the best anabolic stack is not to forget the basics. If they're going to be on these meds with me, we go over every week or every month that they're to do core resistance exercise, track on a body fat scale their lean mass, and it should be going up. It's even better if they're on a dashboard. There's a really fantastic dashboard. I'm on the board. Okay. So it's called Heads Up Health. If they're losing weight too quick and their body mass index API data coming from their body fat scale doesn't show lean mass going up, it flags the practitioner. Because then you can intervene and say, hey, time for a drug holiday. Time for an Ozempic holiday. Yeah. Take it away. But to make sure they're doing the exercise, just like keto or AIP diet, when they're really ketogenic, the high cortisol state creates satiety and they don't want to eat breakfast. So if they wake up and they don't have hunger in the morning, that's not a good sign. They're getting into a hyper cortisol state or a cortisol dysregulation state. And then that's when they start to burn their lean mass, and bone mass will start to go down at that point. Bone mass also goes down for a lot of reasons. Looking at oxalates is helpful. I wish you guys had a panel for that, because oxalates come from candida and mold, which affects everyone with pancreatitis, NASH, fatty liver, type 2 diabetes, pre-diabetic state, and obesity. So oxalates need to be addressed, not to go on a low oxalate diet, but to look at the root cause, which is usually a genetic slip like AGXT. Just throw it out there. Not enough glutathione, not enough B vitamins, right? Those all support the natural oxalate patterns in our body for degradation. But it's the flora. So you guys used to have an oxalate bifido panel and lactobacilli panel, and you guys took it away. Our probiotic has 5 different species of bifido and lacto outside of Oxalobacter formigenes. Our bifidobacterium is one of the strongest oxalate degraders, and we lose it after antibiotics or stress. So restoring these is key, but then to reduce the source, which is mold and candida. Mold and candida pump out oxalates, and this is why PCOS and thyroid goiters, thymus goiters, and parathyroid goiters, and prostate problems, BPH, hypertrophy, they're all related to oxalates and candida and fungal overgrowth, as well as mold. If we lower these with protocols, gut antifungal protocols, as well as low pulsatile doses of pharmaceutical antifungals, we start to see this shift, restore the flora to break down the oxalates. So bifidolong is one, bifidolactis is another, Bifidobacteria infantis. We're all born with the ability to break down oxalates from our diet, right? Kale, spinach, all the good stuff. And the way Mother Nature protects her plants. So these are the root issues. And people don't think of these as anabolic stacks, but they make a huge difference for people developing more musculature, keeping the muscles that they have, as well as growing new ones. A lot of men and women, they're hard gainers. They work out a lot, but never put on muscle mass. That is because their gut is broken. When you have leaky gut, you have leaky muscles. They can't retain the lean mass. Also, leaky gut means broken microbes, right? That means also microbes and mitochondria are synonymous, and our muscles are the richest, densest source of mitochondria, as well as our liver and other things that require a lot of energy, sperm, brain cells. So whatever we do with our muscles, what we see there, we'll also see in parallel with our gut microbiome, actually. So some other anabolics, there's a lot of other anabolic stacks. We can talk about berberine or hydroberberine. There's a lot of fabulous ones. There's a fava bean peptide. I'm really into it. It grows in rodent models. It grows muscles like 3 to 4x. It's in a healthgevity product called Longevity. It's really cool. So it's not banned by a lot of athletic groups. Whereas, as we know, the peptides, whether we're talking about tesamorelin, ipamorelin, or BPC 157, TA1, these are all banned now by WADA, the World Anti-Doping Association. That also means the IOC, the Olympics, the UFC, and other MMA groups. They all ban these for athletes, sadly.
There's so much nuance to what you do and artistry, really. So I wanted to bring up the fact that you have a upcoming webinar for clinicians titled
Yes.
Ozempic and Mounjaro Peptide Protocols for Optimum Fat Loss. Is that right?
Yes.
Yeah, I'd love to know more about that, especially because you mentioned microdosing these GLP-1 agonists. And so it's a very intelligent way of approaching this. As you mentioned, so many adverse side effects with these. What do you want practitioners to know about that? Because I imagine it takes a lot to kind of learn a little bit more about how to implement these things. So is that what they get from that training?
Yes, we really hope that people can be clinicians and health coaches if they want to offer this in their clinic, to have a turnkey way to start to like talk about it with their client base. And because it's also so common, a lot of clients are already on it when they come to me. It's not like they started it. I didn't initiate it. They already came, oftentimes they come to me on it. And I want people to know that there is like any pharmaceutical, there's many dark sides. So I listed many already. And so I have protocols to bypass that, to prevent the problems that we're seeing with it, like rapid weight loss to the point where everyone's skin is like sagging, and then they got to do fillers or other things to overcome that. Yeah.
One thing leads to another.
And and we know so many celebrities that are on it, like Elon Musk and Kim Kardashian. Like it's unrelenting in the media now. And so you are going to have clients come to you on it, and you want to be aware of it. One is that there is a risk of thyroid and endocrine cancers with it. And so I'm not sure if all the fat loss clinics are screening for it, but any history of thyroid or nodular or endocrine cancers is a direct contraindication. They shouldn't actually be on these medications.
Really important right there.
Yeah, really important. Yeah, because it's pretty rampant, our risk of cancer rates now, right? And I like to talk to people about resurrecting what's missing. If someone really needs to be on Wegovy or Ozempic, it's probably because they're missing Akkermansia and Bifidobacterial lactis, and then a lot of the flora that would be, healthy for them for longevity, right? So to get that in there, follow the protocols. It's not that hard at all. And have cancer reduction. Because as we know, when we make short-chain fatty acids like butyrate, that's our natural HDAC inhibitor for cancer prevention. We can have all these really good chemicals by bringing in the flora and the biome. So we wanted it to be turnkey for coaches, get the microdosing. It's going to vary. Every person is really different. We hear of a lot of Ozempic failures. Well, that's probably because of their biome. There's some mismatch there. I've had, like lots of biome damage from antibiotics and IV antibiotics through the C-section surgery. And I'm actually like a semaglutide failure. Like I went all the way up to the highest dose, still didn't work. But I had to fix my gut and bring on a little bit of tirzepatide to get like a balance in the way the GLP-1 agonists work. So everyone's actually a little bit different. And I like to have people learn about this so that they don't get frustrated. And if they also look at titration schedules, there is like slower motility with these, especially if they're going into ketosis inadvertently. Now they're pushing a lot of cortisol, they're losing magnesium, they're going to get constipation, or they're going on to a lower fiber diet because they're not consuming very much. They're consuming 2 potato chips in 2 weeks. Not ideal. And then, their gut motility is going to be changed as well because of the lack of fiber in their diet now. Right. People will lose hair. That's never fun. You could be very skinny, for the first time, but then now your hair's all falling out because of the lack of nutrients. You're not getting biotin and all the B vitamins that are going to support, healthy hair and nails, but also just to support detox and very important things. Because as we lose weight very quickly, if anyone's on interventions for anabolic stacks or weight loss or fat loss, when people rapidly lose weight, if the lymph and liver aren't optimized, there's liberation of many, many fat-soluble toxins. That includes phthalates, even heavy metals, mold even, I believe, a lot of plastics. And when they get out, they can recirculate and go back into peripheral nervous system. But it's even better if we can capture them with fiber. Yeah, so this is when I bring in certain protocols, and people lose weight on them. I love Ultra Binder by Quicksilver. They have chitosan in it, which we know helps with weight loss. It gets converted into chitosan oligosaccharide, actually, and that's when it's helpful for weight loss. But not everybody has the bacteria to create that conversion. So then it's important, for probiotics. Probiotics really have a role. But Ultra Binder and other fiber, Ultra Binder is also high in acacia fiber. We're going to support the gut, and they're not going to, lose so many of the nutrients, and they'll continue to have satiety. So another, all these stacks are really important, I think, because I don't think this trend is going to go away. If anything, there'll be, a short supply and people will want it even more. We're going into an age where it's really hard to lose weight. People are stressed out, they're isolated, their vagal nerve is just going because they're not seeing their friends, or people are still afraid to come out, or they're wearing masks that scare them, right? We've lost a big social texture fabric that keeps us healthy, and our nervous system and vagal nerve really healthy. So vagal nerve is really important. And as soon as it doesn't feel good, people get gut permeability and gut dysbiosis, even if they're doing the best protocols. So I bring that back. We'll have a short discussion about that too for people, because emotional trauma, this is traumatizing. I think people still are in a post-pandemic trauma, and even though they're trying to lose weight, they can't. And they're still eating comfort foods, like high sugar foods, like I did. I've been there as well. So I think there's a lot of challenges with fat loss that we've never had before. People are also on media and they're comparing. And the second we go into comparison, our gut breaks probably, because we're not now trusting, right, ourselves and having our own back. And as an entrepreneur, I'm sure a lot of health practitioners are in the same boat as well. Then we're not at our optimal as a practitioner.
It's mental, emotional, and physical stress, all of it.
It's so complex. Yeah. And, a lot of our clients, they're practitioners. So I see it, from health coaches and doctors' point of view, it's tough, and they're trying to lose weight. They feel pressure because they're the front of their practice. I get it. Yeah. And you don't want to not walk the walk, but it's not your fault for all these stresses or, long haul and the lack of peptides. We weren't taught peptides. I wasn't taught peptides in pharmacy school. Doctors aren't taught, unless you go to an anti-aging regenerative medicine conference, you're not taught peptides. You don't know how to use the peptides, and you're like, oh my God, I don't know how to order it. I don't know how to use it. I don't know how to titrate. I don't know the contraindications. I don't know the adverse effects. I don't know what I can use it with. We'll teach some of that. And so you can learn the synergism of how to combine certain ones and get the best outcomes without side effects. There are contraindications. Like I mentioned, I rarely use BPC 157. I was on a bunch of forums, and had heard certain things, and I looked at the mechanism, and it seemed like across the board, people with mold, if they didn't know they had mold, well, if they have an adverse effect with BPC, they have mold and SIRS. That's like a great litmus
sign
test.
there. Helpful sign.
Yeah, because a lot of people, they look super great on the outside. They may even be an influencer, and it's like, holy fuck, you're screwed. You're fucked. You can't take this, because they have histamines, and they just, drink a bunch of ginger tea and they think they're fine.
Right. It's complicated.
It's their gut. Yeah. And then you check their micro, your mold panel is fabulous, and looking at IgGs against mold, that's the key. We shouldn't be making all these unrelenting immunoglobulins to what is going to be in us. We're all going to have some mold, but we don't want to
avoid
trying to knock it out every second. Yeah.
Wow. It is overwhelming and complex, but what gives me encouragement is knowing there are practitioners like yourself, Dr. Grace, who know how to do this the right way. Because in the wrong hands, it can be scary. There's a lot of things that you need to take into account.
I think so. And it's only, I'm not always right, but I'm always learning along the way. And I'm so grateful for, the people that I interact with. And we're more sick than ever. And I am really grateful for the tools that we have, because they can help bring us out of that dark. Yeah. Thank you so much for sharing about our event. yeah, it's coming up. And even if you happen to miss it, we'll have replays or have ability for you to catch it later. We give 4 CE units for it, or CMEs.
Fantastic.
And it'll be chock full of good research and studies in it as well.
I'm glad to see that you're offering that type of training, because it's, as you said, these drugs are not going away. So if we can manage these safely and strategically, I think that's really going to be the ideal way. So with that, we're going to wrap it up. We're going to do something a little bit fun at the end if you're game. So I'd love to say thank you so much, Dr. Grace. Before we do that, you've shared so much wisdom concerning the gut microbiome and metabolic health. We touched on the important role of Akkermansia in metabolic flexibility, and so many other factors that impact our body composition and a healthy metabolism, along with so many different management strategies too. So with that, we like to send you off with a few non-clinical questions in nature to get to know you a little bit more on the personal level and have a little bit of fun. What do you say?
Oh, yeah, that sounds great.
Wonderful. Okay. So first one, what is your go-to comfort meal?
My parents are from Taiwan. And so I'm really lucky to live in the Bay Area near San Francisco in California. And there's some Taiwanese restaurants. So I love to just chow down on that kind of home food. And it's funny, I don't gain weight even if I eat a lot of it. So it seems like my DNA is happy.
Yeah.
And we heard, it's not so much about the food necessarily. And of course, it's not black and white.
Yeah.
We're not talking about Twinkies here, but we're talking about whole foods. They might be rich. They might, be something we couldn't tolerate in the past. But if the terrain is set up, if the microbiome is set up, if the hormones are set up to tolerate these foods and allow us to enjoy them, I think that's just beautiful. And that's the goal, right?
Right. Exactly. Well, because it's high in plant oils and it's all rice. Cook resistant starch.
And it's delicious.
And delicious.
Exactly. Yes.
All right, Dr. Grace, if you had a spirit animal, what would it be and why?
Oh, that's a really good one. I think one of my spirit animals is, I think it would be a dragon. I really just love dragons. Yeah,
I see that. I'm getting that energy from you.
Yeah. I think someone read my astrology. I'm Aries, and then I have Aries everywhere and Mercury everywhere
fiery,
else.
like me.
It's yes. I'm not twinsing with you. I'm twinsing with Jen, but yes, I get your fire, Dr. Emmy.
I feel you.
Okay, and for our last question, so you're stranded on a desert island. Food and water is accounted for. What is one thing you could not live without?
Okay, this is probably not the most kosher thing, but probably really dark chocolate and red wine.
I love
They're good for the microbiome.
There you go.
That's all you need. A desert island, chocolate, and wine. I love it.
What's your favorite type of dark chocolate?
Dark chocolate. Oh my gosh, I found this this cafe. They have all kinds. So Thomas Keller makes his own chocolate.
Oh,
he's like a Napa guy. Yeah. It is phenomenal. But it's actually called Dragon Cafe. They have all these chocolates there. So I don't have to go shop anywhere. I just go there. Yeah, they have a bazillion kinds of 70% bittersweet chocolate.
I'm going to send you peach chips as soon as we sign up.
Yes.
Thank you for that.
Yes. All right. Well, again, Dr. Grace, we can't thank you enough. It's been insightful. It's been encouraging. Definitely learned a lot today. Tell our listeners where they can find out more about that webinar, maybe your website, your Instagram handle.
Yes, both our website and the Instagram. I kind of got locked out of Facebook temporarily, but we may have it there. But if you go to either, it's up there. So our website is thegutinstitute.com. But if you go to Instagram, it's gut_goddess. And any of those places are awesome. Thank you so much for having me. This was so fun. And I'm so grateful for all the kits you guys make. And they just get better and better and better. Thank you so much.
Yes, thank you. And we're signing off. Thanks for listening today.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.